Hi, this is Dr. Prasad, implantologist and prosthodontist, KIMS Hospitals, Secunderabad, as well as Kondapur HOD. Today we are discussing about the dental implants and its uses. What is a dental implant? Dental implant is a device which is made up of titanium which is embedded in the bone. Why we will embed this thing in the bone? Because whenever you don't have a teeth or when you lost your teeth, to replace that one and to restore back your natural normal teeth for the function and aesthetic purpose, we will artificially replace the teeth. In this artificially replacement procedure, we have two procedures for the fixed one. One is shaping the neighboring teeth and other one is taking support of the underlying bone. Taking support of the underlying bone is called an implantology, where we will place an implant in the bone and we have to wait minimum 4 to 6 months time for the bone to come and adhere to the implant. There are two types of implants available. One is a smooth surface implant and another one is a rough surface implant. Smooth surface implant which aids for the osseointegration, which is called an osseointegration, means adhering bone to the implant, which is a highly success, and from past 40 years we are using this one only. But where are all the things we will use the smooth surface implants? For diabetic patients and for the immune compromised patients, and when there is a less bone, for those patients we will use a smooth surface implants. Who are all the patients not eligible to undergo implant? All the patients are eligible to undergo implant except the few cases. One is uncontrolled diabetic patient, because the patient is uncontrolled. When the patient is uncontrolled, what will happen? Automatically the bone won't come and adhere. Poor quality of bone. When the quality of bone is very poor, it won't come and adhere, the second thing. And cancer patients, they have immune compromise, and the patients who are receiving the radiation therapy for their jaws and all that, and the patients who have a calcium and vitamin D deficiencies, for them also it is not suitable. And for the people, for the kids and all that, till 16 to 17 years we won't give implants because it's a growing jaw. We can't restrict that one by placing an implant. These are all the area. And the final and foremost thing is, if the bone is not available for implant to place, definitely we need a bone. Sufficient amount of width and sufficient amount of length is required. We have to place an implant. But when the bone is very minimal, we can't place an implant in that area. These are all the people where we cannot place an implant for those things. But what are the main advantages of implant? Implant mimics just a natural teeth. It restores all the purpose whatever the natural teeth will do. And third one is, it maintains the width of the bone. And fourth, it lasts longer. And the fifth one is, when compared with the dentures or full mouth implants, when you try to open your mouth, the denture will lift. When you try to eat, denture will lift, and the rocking of the dentures will be there. And finally, dentures will resorb the bone. That means reduce the bone over a period of time, and dentures will cause ulcers in the mouth. All these things won't be there with the implants. It looks natural, and normal teeth, fixed teeth, you might forget over a period of time that you undergone implant treatment. So these are all the major advantages of an implant. For how we will do an implant? For implant, initially we should evaluate and assess the implant, assess the patient bone, either the quality of the bone, either the width of the bone, and what are all the anatomical structures, that is important structure of nerves and vessels which are passing. For that we have to use CBCT scan, which is a 3-dimensional view, where we can visual everything beforehand. Previous days the technology is not available. We used to place an implant very blindfold, but here this is not the case. Everything is in our hand, so that the success rate is more. 98% of success rate when you have all these things before placing an implant in our hand. So for every replacement of it, better think twice before replacing with the alternative treatments apart from the implant. Implant is one of the major choice available nowadays. Think of an implant and just select that implant, what type of implant is available, and go for the implant treatment. That is the best treatment. If you are not suitable, then only opt for the other treatments, and that everything will be in the diagnosed part itself. Everything will be revealed by the dental surgeon. He will investigate, he will give you a treatment plan and everything. The success rate is 98% nowadays. That's why please replace with the dental implants which is available at an affordable prices now. Thank you.